Good morning to all. Welcome, dear colleagues, dear participants. Welcome to our webinar today. My name is Vera Rangiova, and I'm part of the UNICEF Regional Office for Europe and Central Asia Early Childhood Development Team. And I'll be facilitating this webinar today. This is our 11th webinar organized as part of the regional initiative, Health Systems for Early Childhood Development. For those of you who are joining the webinar for the first time, this initiative is a joint endeavor of the UNICEF Regional Office for Europe and Central Asia, WHO Europe, and the International Step-by-Step Association. Last month, we had a webinar which highlighted how important is to identify very early developmental difficulties among children and ensure that they have access to quality support for early childhood development. Today, we will continue our discussion focusing on the next step of the process, namely the provision of early childhood intervention services. We will hear from our speakers today how the paradigm in early childhood intervention has changed over the years and how some countries from our region are now building more coordinated, family-centered and interdisciplinary systems for early childhood intervention. But before going to the speakers and the more exciting part of our webinar, let me just provide you with some technical information. We will have our webinar will be in English, but we will also have a speaker speaking Russian language. We will provide simultaneous interpretation to a couple of languages: Albanian, Azerbaijani, Croatian language, Turkish, Russian, and North Macedonian. At the bottom of your screen, you can see a small globe. This is the interpretation channel. You can click on it and select the channel you would like to listen to. During our webinar, the chat function will be not the chat function will not be active. So if you would like to pose any questions, and we won't have a lot of time for questions and answers. So if you would like to pose questions to the speakers, please send them to us. You can see my email address, and our speakers kindly agree to answer them after the webinar. So let me now introduce our hosts. This webinar will be hosted by UNICEF Regional Office for Europe and Central Asia and WHO Europe. And we have with us representatives of the two organizations. We have here Evelina Borisova, who is the Regional Advisor for UNICEF for Early Childhood Development, and Marty Weber, Team Leader at WHO Europe Office. Dear Eva, would you like to start?
Sure, very happy to. Thank you so much, Vera. I hope colleagues are settled in and already interpretation is working. Dear partners and colleagues, it is really a pleasure on behalf of UNICEF to extend a warm welcome to each and every one of you to today's webinar dedicated to early childhood intervention for children at risk or with developmental delays and disabilities. It is a topic very dear to this initiative, and we've presented and discussed it before, but today we have an opportunity to go deeper in this conversation and to really talk about early childhood intervention as a very invaluable form of support for families whose children, due to biological or environmental factors, may be at risk of not reaching their full developmental potential. Just to give you a few statistics, in Europe and Central Asia region alone, there are over 3 million young children living with disabilities. And we know that this data is not precise and quite elusive, I must say, but we also know that insights from high-income countries suggest that up to 15% of young children may experience delay in one or more developmental domains. Some of these delays may be transient, while others may be a sign of emerging disability that may manifest later in life. But just to say, this topic is very, very important and pertinent to the region overall. Children at risk or with developmental difficulties are a very diverse group with varied needs for support. These needs are influenced by factors such as functional impairments, family dynamics, socioeconomic context, as well as access to essential services. And yet, compelling evidence underscored the profound benefits of timely, early, and high-quality support in these early years for all children. There is also, because of this growing recognition of the importance of the early years support, we are seeing many countries who are really starting across the region to undertake very exciting initiatives and reforms aimed at establishing, improving, as well as expanding national provisions for early childhood intervention. And that is really exciting, and I think we'll hear from some of them today. We at UNICEF and WHO Euro and with all partners acknowledge that this endeavor to really build a long-term sustainable early childhood intervention system is a long-term endeavor and requires long-term commitment and necessitates a fundamental shift in the design and delivery of early childhood intervention services. Contemporary ECI services, they depart from the more traditional medically focused approach and instead are guided by the rights of the child and the social model of disability. These modern services help to address areas of child's difficulties within the family context, leveraging the child's natural environment and recognizing and building upon family strengths, priorities, resources, while at the same time really putting the parents and the family at the focus of the intervention, bolstering parental competencies and enriching the environments within which children are developing, growing, and learning. We all know that for these reforms to succeed, countries need sustained political commitment, effective coordination, and cooperation across sectors. Not always easy, but very important. Alongside, of course, strong professional practices grounded in shared principles, understanding, and scientific evidence. I think throughout this webinar, we will have the privilege of learning from the experiences of 3 countries within the region, and we know many more are on this journey, that are making steady strides towards establishing more cohesive family-centered systems for early childhood intervention. We hope this continues to be an inspiration for the conversation that we've already started since last year, and that in the context of future webinars, more countries will also share further experiences and the path ahead. While approaches and entry points and institutional frameworks may vary, they all converge on the fundamental principles of contemporary ECI, and this is around interdisciplinarity, collaboration, and family centricity, so to say. So we look forward to the conversation today and to seeing these principles come to life in the presentations of the countries with us. Thank you so much, Vera. Over to you.
Thank you, Eva. Thank you. Martin, over to you for a few welcoming remarks.
Thank you very much, Vera, and thanks very much, Evelina, for setting the stage. I don't want to hold you up very much because we are all looking forward to get to the substantial part of it. I just wanted to add a few observations from my perspective. I'm Martin Weber. I'm the Regional Advisor for Child and Adolescent Health in the WHO European Regional Office. And early childhood development has been one of our major obsessions, as those of you know who have been regularly in these webinars. It's very nice to see the number of participants creeping up to 400 now. It shows how enormous the interest is. Vera has said already that we are really getting to the logical next step after developmental monitoring, which we talked about in previous sessions. So we are looking very much forward to have the first few experiences from countries. And as Evelina said, we are looking forward to get more experiences as we are going. Early childhood interventions are not an easy issue. It is very much a health systems and a social care issue where the 2 systems need to interact. We can watch extremes in our region. We see under-provision of intervention, so children don't reach their developmental potential. But on the other side, in several countries, we see over-medicalization of care. We therefore want to make sure that we neither over nor underdoing it. We need the right sort of approach where every child can get what he or she needs, but not being labeled and being prevented from developing further because they might have some sort of a disability. As Evelina said, this is the modern approach to developmental monitoring and developmental interventions. As I said, it is at the interface of social work and health work. Several of the factors which are grounded in the social environment of the child have to be addressed outside the health sector. But when it comes to medical needs, we have to make sure that our primary healthcare providers are well equipped to deal with the medical needs. They can detect, they can counsel, they can advise, and they can say, we cannot deal with this anymore. We need to refer to a specialist to make a diagnosis or to provide specialist services. This is clearly one of the most difficult fields in pediatrics. Being a pediatrician myself, I know how difficult it is to say, this child will develop normally, let's wait another time, or here is something which needs urgent attention. We want to refer to a specialist and we need to provide all the services which the child might require. It's a very tight rope which needs to be walked from over to under provision. So I'm looking forward to hear the 3 country examples today from 3 countries.
Thank you a lot, Martin. Thank you a lot for the nice welcoming words. Now I have the pleasure to introduce our keynote speaker today. And this is Dr. José Boavida, who is a neurodevelopmental pediatrician at Coimbra Children's Hospital in Portugal. He is member of the coordinating team of the National System for Early Childhood Intervention in Portugal, and also member of the European Association on Early Childhood Intervention. Dr. Boavida will talk about the science behind early childhood intervention, the key principles that guide contemporary systems for early childhood intervention, and also the key steps that we need to consider in the process. Dr. Boavida, over to you.
Hello, good morning. Thank you. Thanks for the invitation. Are you listening okay? I think so. Hello? Oh, okay. And so I'll speak as you told, Vera. I'll try to give a basic idea of what is ECI and what has been the paradigm change in the last years. And so I'll start sharing my screen. See. So here it's my screen. My talk will be about general ideas about the development of community-based early intervention programs. So there is, of course, a neurobiological basis of ECI. ECI is different from intervention in other ages because there is an extraordinary neural immaturity. And so the importance of the early years in brain development is easily understood when we see that during the preschool period, there is a 4-fold increase in brain volume, reaching 90% of the adult brain at 6 years of age. So this gives an idea of what happens in the brain in the first years. Decades of research in neuroscience, molecular biology, epigenetics, behavior, social science all combined help explain how healthy development occurs, what is the basic learning process in the first years of life, and how ECI can help when neurodevelopment is affected. And so I'll start just to try to move away. I don't know how I can do it because everybody's on top of my slide and I have difficulty reading. But I'll start with as a pediatrician. I just start with some quoting of a very important paper that the American Academy of Pediatrics published in 2013, where they typically have totally changed the way they used to see ECI, where they used to be very clinical. And they say at a certain point, translating evidence-based neuroscience into functional application of best practice takes into consideration that learning takes place through the repetition of meaningful activities, participating in natural learning opportunities that occur in everyday routines and activities as part of community life, and when children are interested in an activity. So this is a totally different way of looking at ECI. And so, in fact, children learn through repeated interactions with the environment dispersed over time, and not in mass trials like a session of therapy could be. So very young children learn differently. And also, research has been telling us that the effect of professional support on child outcomes is bigger when applied to caregivers' competence than when applied directly to the child, very young children. And why is that? Research also has some answers for this. For example, if you have, for example, a speech and language pathologist that works with for example, a 2-year-old child 1 hour per week, or if you apply the same hour the professional has available to work with caregivers' competence and increase it to develop language, then the caregiver will be around 168 hours a week with a child. Let's say that the child sleeps half of that time, so 84 hours a week working with a child. And this is, of course, has a much bigger effect on the child than if the professional, in this case, I mentioned a 2-year-old, for example, works directly 1 hour per week. And why? Because these repeated interactions with the environment occur on this side of the triangle and not on the other sides. Coming back to the same paper from the American Academy of Pediatrics, they say, based on scientific evidence from the last decades, rather than a medical model wherein a specific therapy is applied directly to the child for a specific malady, the paradigm is shifted to a contextual and consultant-based delivery of supports and services to the family and the infant. And so this paradigm shift that I mentioned means that ECI has moved from providing eligible children child-centered therapeutic services, changing the child's by direct intervention in the child, to a situation where professionals should provide enriched environment with experiences and opportunities that promote competencies, enabling them to participate meaningfully in natural contexts. And so not only work with the child, as well as strengthening the skills of family and other caregivers, helping them to transform everyday activities in excellent learning opportunities. And so typically ECI would be very clinical, very child-centered, following a therapeutic model. And now it has evolved to contextual supports, family-centered contextual supports provided in natural environments, the home, childcare, or preschool. And so this very typical old-fashioned child-centered ECI, where you have a big group of professionals, each one working a specific part of the child, is typically not appropriate for ECI. Of course, ECI needs a different team of professionals, but usually working on a transdisciplinary team model. What is that? And I won't have any time to explain it, but typically there is a team, but from this team there should be an ECI key worker that ideally should belong to the major problem the child and family have, and work directly with the child. And the family knows that that key worker, that professional, has a whole team supporting him or her. So the evidence indicates that intervening early reduces the effects of disabilities and reduces the negative effects associated with poor environmental conditions, provides a foundation for children's lifelong learning and development and health outcomes, and builds and strengthens parent skills. Promotes and enhances families' well-being and quality of life, empowers parents to make informed choices, and increases parents' sense of confidence and competence. And of course, I'm speaking mostly to healthcare professionals, and we all know that healthcare is crucial in the organizing and development of ECI. Why? Because health professionals are usually the best situated to identify very young children with disabling conditions or with risk factors. Healthcare reaches more children under the age of 3 than any other family-facing system. Healthcare represents the most common entry point for developmental assessment and services for children, and the majority of eligible children need ECI because of medical reasons, and a significant number have severe and complex health problems. Another important aspect of the role of health is to reduce developmental risks by reducing, of course, mortality and morbidity, preventing infection and treating infectious diseases, or taking care of a good nutrition. Prenatal and neonatal care, particularly neonatal intensive care, does a lot for the reduction of risks. Genetic counseling and prenatal diagnosis, the identification of biological adversity related with prematurity, asphyxia, toxic exposure, congenital or neonatal infections, and even the identification of social adversity linked to childhood development hazards like poverty, low education, racial discrimination, abuse, mental illness, substance abuse, or severe stress. And this social adversity is typically identified in community-based local health centers. Most countries, most developed countries, have what we can call, in Portugal, we call a child health surveillance program, which is a mandatory program that at certain key ages assesses growth, nutrition, oral health, developmental risk assessment, and developmental monitoring, using, of course, standardized tools. Most of them at this age are completed with the help or by the caregivers. And typical in the first 3 years, most programs propose between 9 and 12 visits. Our national program proposes 12 visits in the first 3 years. And the role of health system, I'll now say something about the participation of health in our system. Happens at 2 levels. One, which is the basic level, it's the primary health care, where family-oriented health care is provided not only to the child, but to the whole family. Developmental screening, identification of delay or disabilities, identification of risk factors, the referral to local ECI team. This referral process is very based on primary health care. And in Portugal, local ECI teams are hosted in local health centers, and so it is the process. And some cases, of course, the referral to child development centers, which is something we have in secondary and tertiary levels, typically in children's hospitals or children's departments in general hospitals. And in those child development centers, there are specialized teams that evaluate and follow up the most complex cases. These teams include developmental pediatricians, psychologists, special educators, different therapists, child neurologists, geneticists, metabolic specialists, and other specialties that some of these situations might need. Of course, it's not only health and social affairs and education. They have an important role as well in the development of ECI. And like health, education, and social sectors, they do not have preventive services or universal children follow-up, but they have very important resources like educators, special educators, psychologists, other professionals, even kindergartens, preschools, or in case of social affairs, they can provide social support. And so all together can build a system, and I'll comment 4 or 5 slides regarding ECI system building. Of course, an ECI system needs to be intersectoral, and the success of intersectoral collaboration should not depend on interactions on a case by case basis, but rather on the construction of an institutional structure. Building such a structure is not easy, and is not it really is an ongoing process, not a one-time exercise, and involves, of course, coordination, partnership, communication, planning, and monitoring. This is the national Portuguese system of ECI. It's called the SNIP, and it results from the work together of the Ministry of Health, Education, and Social Policy. There are some general recommendations that when you plan to start an ECI system, you should follow according to this European agency. Services should reach all children and families as early as possible, should be available as close as possible to families, both at local and community levels, should be affordable or free of charge, provided through public funds, should involve professionals from different disciplines, which facilitates really information and exchange. And the last, I can't read it, but should also involve different services at different levels of national, regional, or local, and different professionals that belong to different departments or sectors. So as a summary, building an ECI intersectoral system involves different steps. First, to define what is ECI, what is the conceptual framework that the country or the region will adopt. Make sure that these 5 recommendations, availability, affordability, proximity, interdisciplinary work, and diversity of services are thought of. To define who should receive ECI, the country or the region needs to identify, to have an identification process, a referral, and a good definition of eligibility criteria. Who should be involved, which services at the different levels, what professionals should be involved, making sure that professional qualification and supervision is there, determine who pays what, and this is a very important issue in the development of everything, to determine financial responsibilities, who pays what, and to also define some quality standards. So these steps to define stakeholders, I would recommend that there should be a central core of public stakeholders involving the 3 ministers, but there can be, there should be other stakeholders like parents' organizations, other civil societies, institutions, and NGOs, universities, and academic experts, and they should construct what we call an official planning committee or an official coordinating committee that should plan and design the system. This planning committee should identify available resources, human, material, training programs, develop a comprehensive strategy for ECI implementation, supervision, define eligibility criteria, define procedures and standards, practical roles and regulations, and plan local ECI teams. Where should they be based? Who will integrate these teams, and how will they function? There should be a clear conceptual framework in the national standard for ECI that should be defined according to what is today very well known as good practice. Make sure when you put together different sectors and departments and professionals, you should make sure that there should be collaboration, partnership, and coordination, because ECI is an interagency and interdisciplinary area of work, is developed jointly by stakeholders, and again, with a good definition of each one and a good definition of financial responsibilities. The structure should be easy. Of course, it's like a pyramid. In the basis, there should be the local ECI teams that should be community-based. In Portugal, for example, they are based in the local health centers, and it's a good experience that we have. There is, at the top of the system, should be national or regional or both coordinating committees involving the main stakeholders. And in our case, we have technical supervision teams that are between the coordination and provide support to local teams. Very fast, the structure, this is the map of Portugal. There's a national coordinating team with 2 representatives from each ministry, 5 regions and 5 regional subcommittees with 1 representative of each ministry, 22 technical supervision teams because we have 22 districts, and 155 local ECI teams involving professionals. These are the professionals of most of the teams. They depend on the size of the teams. In Lisbon or Porto, they are big, very big, and the number of professionals needs to be bigger. But they are based in the local health centers, and they are transdisciplinary and inter-service teams. The physician and the nurses come from the local health center, where, as I told, the most teams are based. The educators, all the professionals from educators come from the reference school for ECI, the local reference school from ECI, and the social worker, psychologists, and therapists, they are paid by social policy ministry, but they are from a private institution. They are hired from a private institution locally, and but paid from social affairs. And the last one, not to forget professional qualification. It's impossible to start a system without thinking of this, because professional qualification is the cornerstone of intersectoral collaboration, because most professionals coming from different sectors, sometimes they don't have a common language, they don't have a common conceptual framework, and that is acquired with a very good investment in professional qualification. And thank you so much.
Thank you, Dr. Boavida. Thank you for this excellent overview of the key principles of contemporary early childhood intervention, but also kind of taking us through the principles that should guide us any system building efforts related to early childhood intervention. I really would like just to highlight something that from your presentation, that contemporary early childhood intervention is a lot about expanding the opportunities for natural learning of the child, and also building parental competencies to provide these opportunities as part of the family daily routines. And also to highlight that the structure of the system may be different, but there are general principles that should underlie, and this is really the interdisciplinary character, interagency character of the system, and the common language and common professional development of all professionals involved in supporting families. Thank you a lot for your presentation.
Thank you.
With the next presentation, we will look at some examples how in our region countries are trying to build these structures, and we will see that there are different approaches building on the national context and also national resources and opportunities for early childhood intervention. I have the pleasure now to introduce our speakers from Serbia, who share their experience. We have with us Mr. Wolf, Filip Wolf, who is a representative of the Ministry of Health, and Dr. Snežana Ilić from the University, Associate Professor from the University of Belgrade, and also member of the working group at the Ministry of Health supporting the implementation of the National Early Childhood Development Program. I'm sure that we will vary a lot from their experience, how they try to strengthen the national provisions for early childhood intervention, align with the key principles of contemporary practice and evidence. Over to Mr. Wolf.
Yeah, hello everyone. I hope you can hear me.
Yes, perfectly.
Yeah.
We can.
Yeah, thank you, Vera. Well, hello everyone. Hello from Belgrade. My name is Filip Wolf. I'm representative of the Ministry of Health of the Republic of Serbia. And first of all, I would like to thank you to our UNICEF regional partners, also to the WHO regional office and our country office, UNICEF, that organized such an important meeting. And it is nice to meet you all and to present our achievements in these topics. First, we can start with slides. Where are you going to help us with the presentations and slides? Or
Yes, they are already on. Yes.
Okay. Okay. So while all young children need nurturing care for early childhood development, such as health, adequate nutrition, responsible parenting, early learning, and safety, almost 60,000 young children in Serbia are facing developmental risks, delays, and disabilities, and need additional support through early intervention services. Next slide, please. Thank you. Well, this is why in 2016, the Ministry of Health adopted a national program for early childhood development. This program clearly indicates the needs for strengthening inclusiveness of the health system and the significance of its cooperation with other sectors in supporting children with the developmental risk, difficulties, and disabilities and their families. In 2018, the Ministries of Health, Education, Social Affairs, and the President of the National Child Rights Council signed a call for action for early childhood development, where it was high quality and acceptable early childhood interventions for children with developmental risks, delays, and disabilities are recognized as a priority. Other sectoral policies in early learning sectors and families cares and demography and child protection are also in line with the key priorities and above mentioned call of action. Next slide, please. Next slide, please.
Sorry, I have a problem with the computer.
Yeah, the most important slide now. Okay. Okay, regarding the role of our ministry, we can mention that the health system has a critical role to play throughout the life cycle of the CWDD, and however, guided by the evidence, in the past decade, mainstreaming disability inclusion within early childhood development and learning has been prioritized and put higher on the governmental agenda. Thus fully acknowledging that timely support to the development and the well-being of young children with delays and disabilities helps them to reach their optimal potential, increases their social participation and inclusion in schools and the community. Overall, it improves the quality of their lives. Under the Ministry of Health leadership, and some critical system changes were initiated. First of all, to increase the availability of the data of the CWD for informing relevant policies, programs, and budget across sector and the Institute of Public Health, of course, with UNICEF support, and has recently established register of children with a disability that is based in the international classification of functioning disability in health. Second, to improve the early detection of delays and the disability and timely response. Important is to progress was achieved in strengthening the capacities of health professionals for developmental screening and developmental monitoring using standardized instruments with partners, with parents, and its integration in the regular pediatric practice. In Serbia, regular preventive checkups, children and their parents are seeing pediatricians at least 10 times before the school entry, with which represent unique opportunity for developmental support. To overcome inefficient knowledge and skills in developmental pediatric, new curricula sets have been prepared for medical students and pediatrics residents in 2 major universities in Serbia. National professional guidelines for screening, diagnostic, early interventions for children with the autism spectrum disorders were developed to support evidence-based practice across the country. Remote teleworking services were also introduced which bridged the gap of lack of support, especially during the COVID-19 crisis. Next slide, please. Yes, here I would like to highlight the most important investments that are currently undertaken by the government and the leadership of the Ministry of Health and in partnership with the UNICEF. In 2017, the Ministry of Health, alongside education and social welfare sectors and international partners such as UNICEF, OSF, and Autism Speaks, initiated a collaborative program aimed at enhancing the early childhood intervention system for children with developmental delays or disabilities and their families. This initiative introduced a family-centered, routine-based, cross-sectoral model aligning with international standards, with support for early aid and ECE professionals from the USA and Portugal. And phasing parental empowerment, the model operates with the national environments like homes, preschools, integrating caregiver skills training. By leveraging existing capacities like developmental counseling units and primary health centers, the program facilitates coordination among professionals to provide integrated support. As a second initiative I wanted to mention is establishing the new National ECD and Inclusion Center. It is recommended that the National ECD Resource Center takes a central place in strengthening and scaling up their network and integrating ECD and ECE services. Establishing as a national reference center for strong experience and capacity, the center should take responsibility for overall coordination to advance evidence-based knowledge and excellence in professional practices by facilitating cooperation between different sectors and institutions toward their integration and in coordinates with the needs, of course, with the children and their parents. And the last slide, please. Yeah. On this slide, you can see the horizontal scaling of innovative practices across the country. Initially piloted in 5 locations, the program with the country office of UNICEF's assistance, and it is to be expanding to all 25 districts to ensure comprehensive coverage, and has already begun its implementation. And sorry, one more slide I think we have for about the further steps. Further steps regarding the Ministry of Health are furthering strengthening the health system, and the first contact with the families and the most important provided to mobilize cross-sectorial and whole society support around the child and the family. Ministry of Health is also committed to ensuring that all these initiatives find their place in national legislation and budgets, that human and institutional capacities are ensured that they become a standardized practice across the country. And we can mention also that one of the priorities is to embrace the approach of the start early and early identification, early interventions, provide unreplaceable support for child development and family straightening. Thank you very much.
Thank you.
Thank you, Vera. I'm very happy to speak after Ministry of Health from the perspective of Serbia. That means that means that we have a support from the ministry, and I have again problem with sharing screen. I don't know why. I'll try again. Sorry. I said that we are very happy to have support from Ministry of Health, who is leading this process in Serbia. And also, I want to tell you that in time when we started, we didn't have this support. And according to the presentation of José Boavida, we need to have intersectoral collaboration for ECD development and ECI system. And that time in 2017, when we did situation analysis in our country, we were talking with all ministries, and at that time we didn't have a leading position. And now I think, and why I'm talking about this now, because this is very, very important. And thanks to Philip and Ministry of Health, we are here now. From 2017, we did a situation analysis because we wanted to know what we have, where we are, what we have from the resources we need to build a system which is evidence-based and family-oriented ECI. And we realized that our early childhood intervention is at the tertiary level of health, which is not available to all parents from suburb and all over the country, and is the most expensive kind of support, and we need this at the local level. And we have developmental counseling units, Philip mentioned, and we use this as a resource, and we realize that we have resources in our professionals because we have special educators, speech therapists, psychologists, and many professionals who are working at the local level with children from 0 to 6. And also, bad thing that we realized that in our country that time we had rehabilitative treatment way of working with children where parents are in front of the professional office and waiting. Maybe this is rude to say, but waiting for professionals to fix their child and go on. And from that part, we tried to get support from professionals and from experts from this field for trainings. And in 2018 and 19, we formed 2 groups of professionals after deep analysis of these 2 locations, and started with the training with the international supervision and trainings from Holly Hicksmall from USA and from Yearly Aid as the European Association of Early Intervention. And from that time, we were in a position to design new model. And I think it is important to emphasize that we started from the local level, from the practitioner level, with what we have, where we are, and where we can go towards to this evidence-based family-oriented model. And we defined a model with 5 pilot locations. We add after that 14 new locations. And during this process, we did very important trainings with Yearly Aid. And after this training, we started to to implementing this. And this is also very important to say, learning by doing and by supervision is very important for all professionals, because from my perspective and from my opinion, and experience from Serbia, Bulgaria, and Montenegro, that professionals and paradigm shift in their philosophy, their approach, their knowledge is the very important in every country. We have providers from transdisciplinary teams from local level, because we have DCU as a health position, and we have professionals there. We added professionals from preschool and from social welfare, and this is a local team where they communicate and have a coordination from the health, from a developmental counseling unit. And this is a family-oriented, home-based and preschool-based provision. And also teleworking, we started during COVID. because we were in the middle of the process and trying to find a way to continue supporting families. And now we can have this experience, and we were talking about quality and standards in our model, including this option also. And we have now not at every location, and we still have parallel system in some locations, but we have early detection by parents and parapediatricians, and also home visiting nurses with the ages and ages questionnaire we standardize for Serbia, and the functional assessment from routine-based interview, from ECOMAP, and functional assessment with IEPS. We are doing individual family service plan for our families and children, and we have home visits weekly, but this is workforce insufficient, still insufficient, from weekly to bi-weekly or monthly. When we are talking about financing, we heard from Jose, and we pretty much looked at Portugal model, but we didn't do this as a copy paste. We did situation analysis, and we are modeling this for Serbian perspective. But these values Jose shared with you, that's the values also for Serbia. And I also need to again say that professional development, it's very important, and this capacity building in our country. And now after these trainings, we have now trainers. We have 13 trainers and 3 supervisors from academia, and more than 500 trained professionals, which approximately 120 it's primary service provider provide this family-oriented ECI to families. And also we now are in a position to have this in syllabus at the faculty level, and also we have at one faculty special education faculty specialization in the family-oriented ECI. And because I'm professor at the Faculty of Special Education and Rehabilitation, I have to tell you that if you start early, if you start at the faculty talking and teaching about family-oriented ECI, this is so fresh and so easy. It's really nice because these students are fresh and not in a traditional rehabilitative treatment model, and this is so logical for them. And I think you need to include this in syllabus and in the faculty, because it is sustainable then. And I think this is taking learned lesson from Serbia. I also need to say something about challenges in all these 3 sectors, at the local level and the ministry level. You need to have the same language of family-oriented ECI, and this is sometimes very hard to organize transdisciplinary approach, because we are still in this traditional model doing with child separately and not sharing information. Now we have to sit together and to think about what is the best for that child and for the family, all together from all professionals and from all 3 sectors. We need in the future strong advocacy at the national and increase financial and human resources to provide required changes in regulation. We are also think if we need a law. You heard from Jose that they have law of ECI. And also I know in our region, Slovenia also have a very good law in this segment, and we have to think about it, because now we are working on enthusiasm, and I am a bit worried as a supervisor what's going on if ministries support us in the future with the workforce, with more professionals, and with this increase in collaboration and support in workforce. And also, I think this is very important, and from the perspective of European Association of Early Childhood Intervention, Early Aid, when I'm board member, we have in our board the parents also, and I think this process is parallel. When parents experience this kind of support, they can also have their voice in the country and in the Europe, and we need to increase the voice of parents. Thank you.
Thank you a lot, Dr. Ilic and Mr. Wolf. It's really, I mean, thank you for sharing honestly your experience through the years, and it's really demonstrate how these principles that Dr. Boavida was talking in the beginning can be put in practice. And also, it's very important that you started with situational analysis, identified what is the entry point for building the system for early childhood intervention through building the commitment, the national commitment of the key government agencies and ministries. And also particularly important is your point about human resources, because they are critical for any quality early childhood intervention services. And I think Serbia is very a good example how to use the health system, the existing strong health system, to build and this intersectoral system of services for families and children. Thank you a lot. And I would like now to introduce our next speakers who also demonstrate how the health system can be really anchor of early childhood intervention services, again with the long-term perspective of bringing the other sectors around the child and the family. We have with us Dr. Anna Simchenko, who is the head of a child health information, methodological and monitoring department of the National Practical Research Center, Mother and Child in Belarus. She's overseeing and supporting the work of early childhood intervention centers that were created across the country over the past years. Thank you a lot, and over to you, Dr. Simchenko.
Слышно меня? Здравствуйте. Могу начинать?
Yes, да, спасибо.
Здравствуйте, уважаемые коллеги. Я хочу выразить благодарность за возможность поделиться нашим опытом развития службы раннего вмешательства в Республике Беларусь. Раннее вмешательство в Республике Беларусь – это приоритет здравоохранения, и это обусловлено прежде всего тем, что здоровье детей – это приоритетная задача здравоохранения, и, с другой стороны, приверженность здравоохранению в нашей стране у населения достаточно высока. Также я хотела бы отметить, что раннее вмешательство закреплено в законе о здравоохранении Республики Беларусь в разделе «Медицинская профилактика», и раннее вмешательство представляет собой ряд организационных и практических мер, действий, которые направлены на выявление детей раннего возраста до 3 лет, которые имеют нарушение развития, инвалидность или риски таких нарушений, а также оказание этим детям помощи. Я хотела бы рассказать нашу историю, наш путь по развитию целой службы раннего вмешательства. Этой службе уже более 20 лет. Первый центр раннего вмешательства – это структура, которая организована на базе амбулаторных организаций здравоохранения, где работает междисциплинарная команда специалистов из здравоохранения и образования. Первый центр раннего вмешательства был открыт в 2002 году на базе 19-й детской поликлиники в столице, городе Минске. Далее мы получили положительный, позитивный опыт раннего вмешательства, и центры раннего вмешательства стали открываться во всех областных городах нашей страны. Далее шел продуктивный период работы Министерства здравоохранения при поддержке детского фонда ЮНИСЕФ. по открытию новых центров в разных городах нашей страны, оснащение, обучение специалистов. И на сегодняшний момент, в 2024 году, мы имеем 47 центров раннего вмешательства, и мы говорим о том, что у нас обеспечен полный охват детей раннего возраста помощью раннего вмешательства. Таким образом, все детское население в возрасте до 3 лет закреплено за территориальным центром раннего вмешательства. Также очередным существенным шагом, который позволил укрепить систему раннего вмешательства, это была разработка нормативно-правовой базы документов, которые регламентируют структуру службы ранней помощи, работу центров, маршрутизацию пациентов, порядок их направления. Очень важное значение имели документы, которые касались организации дистанционного консультирования для того, чтобы мы могли оказывать помощь детям, которые проживают территориально удаленно от центров раннего вмешательства. Последним документом было принятие возможности оказания помощи детям с расстройствами аутистического спектра, также с привлечением центров раннего вмешательства. Очередные организационные шаги в развитии службы включали в себя, безусловно, это мониторинг оказания помощи, ранней помощи детям и оказания услуг. Каждые 3 года мы проводим анализ деятельности центров раннего вмешательства для того, чтобы можно было предпринять последующие шаги по совершенствованию работы центров. Следующий шаг касается анализа данных. У нас создана и функционирует электронная система сбора отчетных данных о работе центров раннего вмешательства. Эти данные в себя включают анализ, какие пациенты, какого возраста приходят в раннее вмешательство, с какими заболеваниями, либо какими нарушениями развития приходят дети, какой объем услуг оказывается, какие специалисты закреплены за каждым центром и так далее. Все эти данные сводятся в единую систему, которую в следующем мы анализируем, и мы можем анализировать работу отдельного центра, отдельного региона или в целом по стране. Это тоже помогает нам принимать последующие шаги для совершенствования службы. Важным шагом является образовательный процесс и повышение образовательного потенциала специалистов. Первым таким шагом была разработка образовательного курса кафедры детской неврологии ведущего университета в нашей стране. Образовательный курс, обучение прошли 3 цикла специалистов. Последующее образование включало в себя обучение всех специалистов, которые работают в раннем вмешательстве, рутинно ориентированному подходу, также при поддержке детского фонда ЮНИСЕФ. И регулярные образовательные программы в течение года, это у нас является наличие различных семинаров, вебинаров, где мы обучаем не только специалистов, которые работают в раннем вмешательстве, но и еще других специалистов, которые отвечают за то, чтобы пациенты, дети были максимально рано диагностированы, раннее выявление и максимально рано направлялись в центры раннего вмешательства. Здесь на слайде представлена карта нашей страны. Вы можете видеть, что все центры раннего вмешательства у нас расположены, скажем так, достаточно равномерно. Наибольшее количество центров сосредоточено в столице нашей страны, в Минске и в Минской области. Это обусловлено тем, что плотность детского населения раннего возраста там наиболее высока. Кроме того, у нас есть опыт работы центров раннего вмешательства на базах домов ребенка. Это тоже очень положительный прогрессивный опыт, который помогает оказывать помощь не только детям, которые территориально закреплены за центром раннего вмешательства в этом городе, но также специалисты оказывают помощь детям, которые находятся в детских домах. У нас разработаны национальные критерии, которые определяют целевую группу детей, кого мы направляем в раннее вмешательство. Прежде всего, критерий первый – это возраст детей. До достижения ребенком полных 3 лет жизни этим детям оказывается помощь. Следующий критерий касается нарушений развития как таковых, которые выявляются различными скрининговыми программами. Следующий критерий касается рисков нарушения развития, то есть с позиции максимально раннего выявления, когда мы видим, что у ребенка есть фон, который может в последующем приводить к нарушениям развития, такого ребенка мы тоже будем направлять для получения ранней помощи. Следующий критерий касается детей, у которых уже установлен диагноз, который с большей степенью вероятности может приводить к нарушениям развития или инвалидности. Следующий критерий касается непосредственно детей, у которых уже установлена инвалидность, эти дети у нас в приоритете для получения помощи. И следующий критерий касается детей, которые находятся в социально опасном положении, которые также имеют риски нарушения развития. И седьмой критерий определяет получение помощи пациентами, родители которых обращаются в центры раннего вмешательства с целью провести оценку развития ребенка, либо если их беспокоят какие-то вопросы относительно развития ребенка. В целом мы можем отметить, что в раннее вмешательство, центры раннего вмешательства родители могут обратиться самостоятельно. Они могут обратиться по направлению педиатра, который наблюдает ребенка в территориальной организации здравоохранения. Также они могут обратиться в центр раннего вмешательства при направлении любого другого специалиста, который консультировал ребенка и выявил у него возможные риски нарушений развития. Здесь представлен наш опыт работы раннего вмешательства. По мере, скажем так, увеличения центров раннего вмешательства в нашей стране увеличивается количество специалистов, которые работают в составе междисциплинарных команд. И на сегодняшний момент специалисты включают в себя медицинские специалисты, это врачи-педиатры, либо врачи-неврологи, 36%, и около половины это специалисты педагогического профиля, логопеды или психологи. На правом слайде представлена диаграмма, которая отражает охват пациентов услугами раннего вмешательства. Безусловно, время ковида сказалось в 2020 году, и мы отметили некоторое снижение, я бы даже сказала, существенное снижение пациентов, которые обращаются в центры раннего вмешательства первично. Тем не менее, те пациенты, которые уже получали раннюю помощь, их количество снизилось незначительно. На сегодняшний момент, по итогам 2023 года, мы можем сказать, что мы уже вышли на уровень, который был до ковида, и сегодня раннюю помощь получают порядка 13 тысяч детей раннего возраста до 3 лет, и это составляет 4,7% детей в возрасте до 3 лет. Формы работы в центрах раннего вмешательства преимущественно, когда ребенок поступает в центр раннего вмешательства, приходят к родителям, либо его направляют. Все дети проходят процедуру первичного приема, когда проводятся диагностические процедуры и разрабатывается индивидуальный профиль развития ребенка. При необходимости последующие визиты могут быть связаны с более углубленной диагностикой каких-то отдельных линий развития ребенка. Также после первичного приема определяется необходимость ребенка в раннем вмешательстве, а также объем этого вмешательства. Преимущественно вся работа междисциплинарной команды укладывается в проведение индивидуальных или групповых занятий, это 70%. Также у нас предусмотрена возможность визитов на дом для тех пациентов, которые маломобильны, либо по состоянию соматического здоровья не могут посещать центры раннего вмешательства. К таким пациентам специалисты могут приходить на дом и оказывать помощь на дому. Дистанционное консультирование тоже важный и существенный шаг, который позволил охватить еще большее количество пациентов, которые проживают в наиболее удаленных уголках нашей страны. Безусловно, дистанционное консультирование осуществляется после того, когда ребенок с родителями приходит очно на первичный прием в центр раннего вмешательства. Далее помощь может быть оказана дистанционно. Все услуги раннего вмешательства у нас укладываются в помощь, которая оказывается в режиме мониторинга, тогда, когда у ребенка не установлены нарушения развития, но сохраняется, допустим, риск. либо нарушения какие-то незначительные, тогда мы можем предложить семье наблюдаться в центре раннего вмешательства в режиме мониторинга, то есть эпизодически с определенной кратностью, например, раз в 3 месяца, приходить для проведения диагностических процедур. Помощь может быть кратковременная, когда разрабатывается индивидуальная программа раннего вмешательства для конкретного ребенка, и эта программа реализуется в срок до 6 месяцев, и долговременная помощь оказывается ребенку с выраженными нарушениями развития, инвалидностью длительностью до года, с обязательным контролем проведения диагностических процедур раз в 12 недель. В общем-то, реализация индивидуальной программы раннего вмешательства включает в себя содействие развитию ребенка по всем линиям развития. Это и содействие развитию мобильности, содействие развитию коммуникации, это содействие развитию функционирования ребенка в естественных жизненных ситуациях, формирование адаптивного поведения, развитие навыков самообслуживания, бытовых навыков. Это содействие социализации и развитию познавательной активности ребенка. И, безусловно, это полноценное психологическое консультирование и сопровождение семьи, в которой воспитывается и растет ребенок с инвалидностью и нарушениями развития. Также одним из серьезных шагов в нашей стране являлся тот факт, что недоношенные дети, которые составляют самую высокую группу риска по нарушениям развития и инвалидизирующим расстройствам, мы также их наблюдаем в контексте обязательного посещения центров раннего вмешательства буквально через месяц после того, как они выписываются из родильных домов и отделений второго этапа выхаживания. Эти дети должны быть обязательно направлены в центр раннего вмешательства, где специалисты составляют для них индивидуальный профиль развития ребенка и наблюдаются наравне с республиканским центром катамнеза настолько интенсивно, насколько нужно для конкретного ребенка в соответствии с его сроком гестации. Кроме того, у нас ведется регистр, сбор данных по заболеваемости недоношенных детей для того, чтобы мы могли прогнозировать, в какой группе детей риски нарушений наиболее высоки, и это в будущем поможет нам предпринимать новые действия для минимизации этих рисков. Еще один важный документ и шаг, который приняли 3 министерства. Это Министерство здравоохранения, Министерство образования, Министерство труда и социальной защиты. Они разработали единый документ с концепцией мероприятий, которые касаются оказания помощи лицам с нарушениями развития. Этот документ называется «Дорожная карта», и он у нас действует в нашей стране в период до 2025 года. Он включает большой перечень мероприятий от подготовки специалистов до улучшения доступа к помощи, построения образовательного маршрута, социальной защиты и так далее. В общем-то, это взаимодействие сосредоточено на 3 структурах. Центры раннего вмешательства, которые подчиняются Министерству здравоохранения. У нас есть также центры развивающего обучения и реабилитации, которые подчиняются Министерству образования, и территориальные центры социальной защиты населения, которые подчиняются Министерству труда и социальной защиты. При взаимодействии посредством местных, локальных нормативных актов удается улучшить оказание помощи детям с нарушениями развития. Как я уже говорила, очередным важным шагом было активное внедрение дистанционного консультирования. Наши центры раннего вмешательства оснащены необходимым техническим оборудованием для того, чтобы можно было оказывать помощь детям, которые проживают, и их семьям, которые проживают в территориально удаленных регионах. Лучшие мировые практики мы используем в работе раннего вмешательства в Беларуси. Безусловно, это оценка развития ребенка на основании международной классификации функционирования. Это очень важный инструмент, который позволяет специалистам разного профиля, медицинским работникам, педагогическим работникам понимать нарушения в одном, скажем так, в одной плоскости и для того, чтобы они могли более эффективно оказывать помощь. Далее мы внедряем в практику работы шкалы развития Бейли. Также все специалисты у нас обучены рутинно-ориентированному подходу и коучингу родителей, потому что раннее вмешательство работает непосредственно с семьей. Активно развивается и внедряется терапия кормления, потому что мы прекрасно понимаем, от элементарного нутритивного статуса пациента будет зависеть его реабилитационный потенциал и то, насколько эффективно он сможет развить у себя те навыки и способности, которые позволяют развить его генетическая программа этого ребенка. Также активно используется денверская модель раннего вмешательства при оказании помощи детям с расстройствами аутистического спектра. Ну и стратегически важные шаги, которые наша система раннего вмешательства в Республике Беларусь, в общем-то, планирует для реализации в будущем. Мы не останавливаемся на достигнутом, мы регулярно проводим мониторинг своей работы, оцениваем результаты и понимаем, что нам нужна система мониторинга раннего детского развития на уровне амбулаторного звена здравоохранения, туда именно в той организации, куда дети приходят первично, для более эффективного выявления, максимально раннего выявления нарушений развития у детей. Также мы уделяем большое внимание улучшению профессиональных компетенций специалистов, потому что действительно в работе появляются различные новые технологии, методики, которые имеют доказательную эффективность, доказательную базу по диагностическим процедурам, по непосредственно оказанию помощи абилитации. Все эти вещи мы стараемся максимально эффективно адаптировать для нашей страны и внедрять в работу специалистов, обучая их. Также мы планируем расширять сеть центров раннего вмешательства для того, чтобы еще больше улучшить доступность этих услуг для семей. И важным шагом также является усиление нормативной базы именно с акцентом на качество оказания услуг раннего вмешательства. Я благодарю вас за внимание.
Thank you a lot, Dr. Simchenko. It's really amazing how for a very short period, Belarus managed to expand the services for early childhood intervention across the country. And you also show something that was mentioned before, that it's really building the system is a really process. It's not one-time activity. It's constantly evolving and changing. And it's a process that also requires consistency of efforts over the years. Thank you a lot. And I would like our last speaker is from Bulgaria, and we will see a little bit different approach in building the system. Because so far our speakers showed an experience from countries where the health systems was really the leading system on the establishment and expansion of early childhood intervention services. The experience of Bulgaria shows the potential and of the social service sectors for anchoring early childhood intervention services. Unfortunately, we do not have the speakers initially announced from the Ministry of Labour and Social Policy due to some health emergency, but we have with us a colleague from the UNICEF office in Bulgaria who will deliver his presentation. Vanya, over to you, if you can.
Well, thank you, Vera, and thanks to the organizers for this very informative webinar. I would like to apologize again on behalf of Ognian Drumev, who is the representative of the Ministry of Labor and Social Policy in Bulgaria, who was supposed to deliver this presentation, but an emergency health issue has come up, and at this short notice, it's not been possible to involve another representative. However, I have been on, I am part of UNICEF's team, but I have been on secondment to the Ministry of Labor and Social Policy over the past couple of months. And I've been working to support them in the development of the program for early childhood intervention that I'll be telling you about today. So I hope to be able to deliver the presentation as intended. The text has been agreed by the ministry. So I'm going to tell you about three main things. First, I will tell you a little bit about the context in Bulgaria for the national program. Then I will tell you a little bit about a survey that was carried out as part of this program earlier, so a few months ago. And then I'll tell you about the program itself. So in terms of the context of ECI services in Bulgaria, I'd like to start by mentioning the process of deinstitutionalization of childcare, which has been ongoing in Bulgaria over the past 2 decades. The importance of this really can't be overstated because 2 decades ago in Bulgaria, a large number of children with disabilities lived in large institutions. And Bulgaria embarked on a major reform, which has led to the closure of practically all of these large institutions over the past decades. So there has been a huge growth in the number of children who live with their families in a family environment. And so the actual need for early childhood intervention services arose from this fact, from the children who are now living with their families instead of in institutional care. And a large network of social services actually has emerged to support families. And these social services work on various themes. So they're not only early intervention, but they also work on prevention of abandonment. They carry out social work, and they are municipal based. So they're very close to the people. And in 2016, work began on a new Social Services Act, which was completed and adopted a couple of years later, which regulated these services. And so the Bulgarian early childhood intervention system is primarily based within the social system rather than health, as the previous speakers mentioned. I'd like to also mention that we have, again, the deinstitutionalization of childcare and the reforms that have taken place have also placed the focus on the need for inclusive education of children. And so we have also a new law that regulates preschool and school education, which contains extensive provisions for inclusion of children with disabilities and developmental delays in the mass education system rather than in separate educational environment. And so in several projects and programs have taken place over the past years, which led to the development of the network of ECI services. And the first of those was a project funded through the World Bank, the Social Inclusion Project, which created approximately 60 services around the country, services which were focused generally on early childhood development, but containing an ECI component. And those services, after the end of the World Bank project, have been funded through the EU's Human Resource Development Program. And so generally the services were developed in this way, and in addition, several NGOs have piloted good practices, and the new program that I will be telling you about is actually based on all this experience that was gathered. In terms of the legal framework for ECI services, as I mentioned, we have the Social Services Act, which basically contains the definition for early intervention. You can see the aims of the act on the slide. But the idea is that early intervention is for children aged 0 to 7. That's part of the official definition. And it's directed towards children with disabilities, with developmental difficulties, and children at risk of developmental difficulties. Those services are free of charge, and they are provided by the municipalities. So the Act regulates the provision of all types of social services, and it includes regulation about who can provide them, the licensing regimes. It introduces quality standards for these services, and it also includes a set of financial standards which are actually currently being revised in line with this legislation. It also creates a new body which has been functioning for the past couple of years. This is an agency for the quality of social services, and this agency has a monitoring role, and it's also the body that licenses services. So the lead ministry is, of course, the Ministry of Labor and Social Policy, but the actual providers of services are municipalities, and the municipalities themselves can delegate service provision to NGOs or to private providers. So the funding for these services is coming directly from the ministry, which transfers funds in accordance with the financial standards to municipalities. And if the municipalities decide to delegate the services, they can further transfer the funding to NGOs. What characterizes these services is that they are community-based and that they usually, in most cases, have multidisciplinary teams of containing various types of specialists, including psychologists, social workers, speech and language therapists, and various others. So it makes them really the best place available to provide the kind of multidisciplinary services that also Dr. Boavida was mentioning as best practice. So I'm going on to the survey that we carried out last year. So the government decided that it is time to expand the network of ECI service provision and create a national program which will ensure that every child that needs, every family that needs ECI services will receive them, so that we move away from a model of pockets of services and services in some places and an uneven distribution towards a model of uniform provision throughout the country. And to do this, we actually carried out a survey of the existing services that have ECI components. And 177 services were surveyed, and of those, 50 were selected for a detailed analysis. And the reason that those exactly 50 were selected was because they are located in larger regional centers. And the aim of the survey was really to determine the readiness of the existing services to implement the national program and to set out the criteria for inclusion of services in this national program. It was an extensive survey where we found a large number of findings. What we wanted to see is we knew that there are plenty of services in Bulgaria that call themselves early childhood intervention in accordance with the law, but the content of these services varies really widely. So we wanted to see what are these services actually doing. And here is a brief kind of a snapshot of what we found. We found that the services have really varied practices. So some of them were focused towards parents. They included trainings for parents, counseling, social work, support groups, support from health or educational mediators. And some of them included services for children. Child development assessment, various types of therapy, and special educational support. And a lot of the services included a mixture of both, but really no kind of common methodology through which they work. And everyone, really what we found is that everyone understands a different thing when we say ECI. For some services, really they would only provide, let's say, speech and language therapy, and they would call that early childhood intervention, whereas others would, let's say, provide just social work or counseling for parents, and again, call that early childhood intervention. So really varied practice And one of the aims of the program is to move towards a model where this practice becomes a little bit more uniform throughout the country. And another finding you can see is we surveyed the extent to which parents are actually included in existing ECI services. As you heard from Dr. Boavida and you're aware from international best practice, it's absolutely key to work with the parents and the caregivers if we are to be providing quality early intervention services. Unfortunately, however, in Bulgaria, from the 50 services that we surveyed, we found that only 8 of them have a strong component of parental inclusion. 18 of them did not regularly involve parents at all. So 18 of them really worked only with the children in a therapy setting, and 24 services had a sort of mixed, or most of them really rather weak inclusion of parents in early intervention. And now the national program. So the program, I should say, is still under preparation. So it would have some changes to it, but it's rather in a final format at the moment. So I expect that what I present will be the kind of final look of the program. The system, actually, the element of services is part of the overall effort to build a national system for early intervention. So the previous speakers spoke about their systems and the involvement of all the sectors. In Bulgaria, we are, I think, right now at a level where we are just starting to build a systematically our early intervention system. And this is actually something that's been included in the action plan for the European Child Guarantee, which is being implemented. And one of the reasons that we focused first on the services and not on the developmental monitoring, there's 2 reasons. One of them is that, first of all, there is a system for developmental monitoring and identification of children through the health system. But at the moment, this is again done in a kind of non-uniform way throughout the country and without the use of formal screening tools. And we are kind of taking steps towards improving this, but the first step was actually that we have services to take the children. So the idea is that we first need services, and then we need the health system to start identifying children, because in a place where you start identifying without any place to refer the children, this is not good. There's no use in identifying children if you don't have where to refer them to. So the program's key aim is, as I said, to develop this network first, while at the same time working to introduce stronger identification and monitoring. And it's a 2-year program duration, and it has 3 phases in accordance with how ready are the services to actually start working. So these are the key aims of the program. As I said, the really overall aim is to ensure that every child, every family has access to quality ECI services. Also, another aim is to actually upskill the ECI service specialists and to introduce to them the methods and the quality standards that should be followed to have a high quality practice. So the family-centered focus, the idea that services should be going to the families in their homes, in the child's natural environment, the idea that the specialist should work with the parents. All of these are going to be introduced through a program of intensive introductory and upgraded training, followed by methodological support and supervision of ECI service specialists. And another aim of the program is to facilitate the inclusion of children into early childhood education and care services. So these are nurseries and kindergartens that are part of the education system in the case of kindergartens, and those services which are mandated by law to include children. What practice and research has found is that they're actually struggling with this. So another aim of the program is to support those services to ensure that children are included in early education and care. And to move towards, again, a systemic approach where stronger national standards, data collection mechanisms, and inter-system or inter-sectoral coordination mechanisms are introduced. And another aim of the program is to actually carry out communication activities in local communities so that people can be informed about the need for ECI and generally to actually also address the prevailing negative attitudes towards children and their families. The target groups, so even though the law actually states that early intervention is for the ages 0 to 7, in the national program, the aim will be to somewhat bring down this age. One of the other findings of the survey is that actually most of the services that work on early intervention at the moment actually start quite late, so that most children start to be seen when they're about 2 or 3 years old. And we are missing a key early 0 to 3 age. So the program will rather target the age group of 0 to 5, and those will be children both with diagnosed disabilities or children with developmental difficulties, whereby their screening indicates that the child has them, or children who are at risk of developmental difficulties due to various environmental factors or factors in the family. So this last group at the moment is actually currently being missed. So the majority of services really are for children either with diagnosed disabilities or children which have established difficulties. And the other target groups, of course, are the specialists. So the specialists working in the ECI services and also the specialists who work in the mass ECEC services. This is a kind of scheme of the activities, although under each activity there are various others, but the main 4 are here, and the first is related to establishing the actual network. So this will mean ensuring that every region of Bulgaria, there is 28 regions in total, has a functioning ECI team, a mobile team, ensure that this team reaches every municipality. And ensure that actually the teams are have sufficient human resources and capacity to cover the whole country. The second activity is related to, once those teams are established, to provide provision of training to the specialists. So this is both induction training and follow-up training throughout the course of the program, and also ensure the availability of supervision and methodological support. So for this, a national unit will be formed, a national coordination unit, and this will include both kind of the general coordination activities and the activities related to the supervision and methodological support. So a group of specialists is envisioned to function at the national level, who will oversee the implementation of the program. And then within each region, there's going to be also a regional coordinator, and this person will be responsible for coordinating at the local level, collecting data, and also trying to link the different sectors together. So this key component, which is one of the aims of the program, is also going to be within the functions of the regional coordinators. And then generally, as I mentioned, the aim of the program is to facilitate the conditions for building a national system for early childhood intervention. So the standard development and setting, the creation of various methodological documents, and really the kind of support in establishing a systematic approach so that really every child is reached. This is what we expect to see as results. So we'd like to see that every child in every region has access to ECI services. We hope that the ECI specialists will have increased capacities, that we will have developed quality standards, methodology, and entry and exit criteria for services. So at the moment, actually, entry criteria is quite loosely understood around the country, and we want to have a stronger fixed criteria for entry and exit into the service. While also developing competency profiles of ECI specialists and strengthening cross-sectoral coordination mechanisms. Thank you for the attention, and I am available for questions if you have any.
Thank you a lot, Vanya. Thank you a lot for your presentation. It really showed that Bulgaria has already have the legal basis for building a system for early childhood intervention, but there is a lot of work ahead of the country as well to align the services also with the contemporary practice and key principles of early childhood intervention. But it's really amazing the political commitment that exists within the country and the focus on building the system. Thank you a lot. We are towards the end of our webinar, and I would like to give my colleague Alexandra Jovic from the regional office of UNICEF for the closing remarks. But just before that, I would like to say that, as I mentioned, due to some technical issues, we could not provide space for questions in the chat, but you will see in the chat my email. So if you have any questions to the speakers, you can email them to me and I'll forward them to the speakers who kindly agree to answer them by mail. So over to Alex for the closing remarks.
Thanks a lot for the honor to close this wonderful webinar in which we had high participation all the way until the end. And thank you all for being eager to join us and to stay with us until the end. I'm also, really want to thank all the countries that have really honestly shared not only successes, but also the challenges in this journey, because establishing contemporary early childhood intervention service systems is not an easy journey. It takes time and it takes commitment. What I would like to summarize, if that is even possible, is just to repeat what we heard today, is that contemporary ECI is built on a paradigm shift that really acknowledges science on brain development, on how children learn, and evidence so far that goes from the 70s of the last century on what are effective ECI service programs. It is important that it focuses on child and the family that are supported in natural environment by transdisciplinary or multidisciplinary teams. And the very reason for all of these principles is it that only if we apply these principles, the services will be the most effective for children and families. We know that from many different approaches and services, we can do modifications, we can change things, but they become less effective. So these key principles need to find its way to however we organize the service provision. And we see that, and I'm really grateful for Bulgaria for sharing, because we see that problem across the countries, that contemporary ECI is not understood in the same way by all stakeholders. So we need to build efforts to build common understanding and the same language through training, through joint dialogues, through sharing of experiences such as this one. We also heard that in different countries, different sectors might have very different roles in how to organize and provide ECI services. And that is all perfect, as long as, again, they make an effort to obey the same principles of effective services. They have to have a role in conceptualization of the services, their organization, coordination, financing, delivery, and the ways on how to secure that these professionals that are members of the multi-sectoral or transdisciplinary teams are actually staffed and well-trained. And don't forget that what we heard as well, that parents needs to participate in all the steps and all the phases of the process, from conceptualization of the system to the service delivery. Health system has a very important role because of its early contact, because of its universal contact with children and families, and its very unique role in early identification. So as a health systems for ECD platform, we are particularly highlighting this role. We have also acknowledged that effective provision of ECI services requires a national system, not only a patchy provision of services here and there, but in order to really ensure affordable, accessible system that operates in every part of the country, we will need a national system. And that system needs to have defined building blocks, roles and responsibilities, standards, trained professionals, supervised, continuously monitored, and aiming for quality improvements. That can have, again, the story of the 3 countries tells us that these systems can be really organized very, very differently. We have also heard the good recommendation that the best is to start with a situation analysis and to see for the countries who really want to invest more efforts into building contemporary services. We know that in our region as well, the majority of the countries are in transition from the medically oriented model to something that is more contemporary. But early childhood intervention analysis, situation analysis is an excellent start to identify what are the local resources that we have, to bring the main stakeholders around the same table, and to build a roadmap for our country that fits our context the best. Training cannot be overestimated, and I hope that you have heard examples as well from the beginning, how the training was part of the in-service to how it ended up in university curriculums to enable sustainable expansion. I hope that this is not the last learning opportunity, but only one in many that will follow. And I invite you, as Vera already said, to share your questions and to contact one another, and UNICEF local offices will be happy as well to provide what they're working on. And we are looking forward to see you at the next occasion. Over to you, Vera.
Thank you, Alex, for the closing remarks. And I think I'm afraid that we're at the end of our webinar. And I would like to thank you, all of you, for your participation and being with us until the end. And hope that you really, everyone managed to take something from this webinar to inspire or maybe inform the work around early childhood intervention. We are looking to see you with our next webinars, and I wish you a very nice day. Bye. Goodbye.